Okay. All right. Good morning, everyone. Let's see. This is our presentation, Dr. Daniels and I, and the title is Wellness, COVID-19, Telemental Health, and the Geriatric Community. But if you notice, I'll explain later on, we kind of tweaked and changed the title to older adults, just thinking about using strength-based languages in the things in our interactions with each other and with the community. Okay, so just introductions. My name is Kim Tribbett. I'm a graduate student at Rider University in the Clinical Mental Health Care Counseling Program. I'm scheduled to graduate in December 2021. Knock on press wood, right? I'm currently a practicum student in the substance abuse field and this is a part of my studies. I mean, we all have practicum internships, and I'm right now focusing on the fundamentals and and the specifics of joining the counseling profession. I'm not strictly a traditional student. I said before, I'm currently completing my master's level coursework at Rider. And I guess it's not traditional in that it isn't directly after receiving my undergraduate degree. I don't have the luxury or the pleasure, because it would be really a pleasure to just be a full-time student, as many traditional students do. As a result, to pay bills, we all have to pay bills. I've continued my full-time work at the Institute for Advanced Study as a computing support specialist. That's my job title. This position and other similar positions have allowed me to accumulate nearly 30 years in the IT industry. And it's experience that I've been able to draw on for just the stories, anecdotal information, and from those experiences. And those experiences center around the who, what, where, whys, and how people use and connect with others, how people use technology and how they use technology to connect with others. So, and meaning just like various aspects of our backgrounds and experiences intersect to define and shape our identities, intersections happen, offering us new ways to view our careers, and the way we marry our areas of interest and expertise. So in my case, I've been afforded a unique perspective on counseling as it intersects with technology. Again and again, I've encountered this intersection of counseling and information technology. This is especially true in the lives of older adults. Just a bit of background information. If you guys aren't familiar with the Institute for Advanced Study, the design and function of the Institute allows me the opportunity to work with quite a large number of older adults. Like some background information on the Institute, or IAS. IAS is one of the world's leading centers for curiosity-driven basic research. It's located in Princeton, New Jersey. It was established in 1930 from its mission statement. I plucked it off the website. The Institute is pledged to assemble a group of scientists and scholars who, with their pupils and assistants, I'm one of the assistants, may devote themselves to the task of pushing beyond the present limits of human knowledge to training those who may carry on in this sense. And like I said earlier, I'm one of the assistants. I get to be the assistant, which is actually quite fascinating. Some more information about the scholars that are on campus. IS has permanent scholars. We don't have a student body per se. We have visiting scholars that come in. I'll talk about that a little bit later. But our permanent scholars, which are called faculty members, retire at a very specific age, and it's typically around 70. After which a faculty member becomes emeriti, but they still remain very active. They remain very active members of the academic world. They're authors, speakers, presenters. In general, they're just continuing the same work that they did before they retire. And many still either live directly on campus or we have a huge campus, or in the houses that are next to or on the IAS property or the IAS campus. Also, if you're not familiar, although I spoke on this earlier, although IAS is considered an academic institution, it doesn't have a student body per se. So IAS has a rotation of visiting scholars, or members as they're called, and they're selected by the faculty of each school. We have historical studies, social science, math, natural science. Members come to the Institute for various periods of time. Sometimes as short as one term, and sometimes they stay for several years. Some of the scholars are younger, but where the idea of older adults come in, but many senior scholars whose reputations have already been established also come, and they're members. They're members of our student body. Well, they're members of our academic community. So just a small caveat. I mean, like, I have to say that this is one of the most enjoyable functions of my day job. I refer to it as my day job, is working with older adults. You know, after nearly 30 years in the IT industry, especially my work at IAS, what just is obvious over and over and over again is the potentially helpful role of technology in the wellness in the wellness of older adults. Just one last thing before we get started. You may have noticed a change in the title. An effort to use strength-based language to avoid language that lends itself to the avoidance of stigma, and to use language that takes the focus, to use language that puts a focus on the strengths and capabilities of individuals. We decided to use the term older adults as opposed to the geriatric community. So I do apologize for the mistake. This was a mistake on my part, and not Dr. Daniels.
Yeah, and also it's a trending topic now in the counseling literature, and also just throughout the different mental health professions as well, of what do we call this population? Let's remove some of these terms that are, maybe they're more medical, medical terminology when we say geriatric, but those have negative connotations and lead to that older adult population to just be kind of put in this box of, oh, they don't have certain abilities, or they can't do this or that, and kind of disempowering. So a quick introduction to who I am. I am Aubrey Daniels. I'm a licensed professional counselor in New Jersey and Pennsylvania. And I'm also an assistant professor at Rider University. Basically, my clinical interests are pretty much all over the board. So as it says here, across the lifespan, from in school settings with kindergarteners up till high school, through college settings and community mental health settings with a wide range of clientele, where actually I had that older adult population in the community mental health settings actually. As far as research is concerned, my area is really focused on trauma as like the big umbrella of my research, and trauma-informed care, which trickles into the advocacy and multicultural counseling, enhancing our understanding of having difficult conversations and recognizing biases as counselors, which will actually enhance counselors' work. We'll talk about biases a little bit today, because with the ACA advocacy competencies, a huge part that you don't see on the chart is that reflection piece. So understanding, oh, where do my biases lie, or how do I view certain populations? How can that get in the way of the way that I work? Or maybe how have I been influenced by society? And with the older population, there is a lot of outside influences, with filters, smoothing out skin and removing wrinkles, and just changing the face and giving us this ideal of, oh, everybody needs to look a certain way, and once you hit a certain age, you're almost disposable to society, which is a terrible, terrible thing. And as counselors and advocates, we want to jump in there and fight that narrative. Let's see, anything else about me that I want to share? That's it for now, but you'll learn more about us as we continue.
Okay, this is with Dr. Peggy Swarbricks. I hope I'm saying her name right. Her wellness model, her 2012 wellness model in mind. There are 8 dimensions of wellness. These dimensions are physical, emotional slash mental, spiritual, social, intellectual, environmental, financial, occupational. 2 of the 8 dimensions of wellness that we would consider with respect to their intersections with technology and telemental health are the physical and emotional dimensions. And this is especially true or relevant during the COVID-19 pandemic. That's not to say that the other dimensions wouldn't or couldn't be impacted or improved by technology. However, technology in conjunction with telemental health supports improved physical, emotional, and mental wellness of older adults. We can briefly touch on the spiritual, social, intellectual, and environmental elements of excuse me, of the lives, elements of the lives of older adults later if there's time. Financial and occupational elements of wellness aren't necessarily within the scope of this presentation. Just a quick poll, you guys, if you want to put some answers in the chat. How many of us have experience with telemental health? And then if you could also just drop down in there, maybe 1 answer, combined answer, 2 answers. To what extent do you currently work with older adults? Dr. D, can you see the chat? I can't necessarily see the chat when I have the screen up like that.
And I will.
Dr. Daniels, I'm going to use your formal title now, Dr. Daniels.
I'll let you know as they come in.
Okay, so it's been my experience that that the first thing that comes to mind when considering telemental health is video chat. I mean, I think it makes sense. It makes sense to use video chat to connect with clients because outside of being in the same room with a client, there seems to be no better way to observe their manner of speech, clothing, grooming, status, posture, facial expressions, body movements. Basically, we get a complete picture of their general appearance. You know, that's not to say that video chat, that is to say that video chat is an effective way to connect with older adults during the isolation recommended during the pandemic. A decline or a change in any of these areas of concern can signal the need for conversation and possible interventions. Services such as psychotherapy, counseling, supplemental support services, accompanied by face-to-face therapy, self-directed services such as online services that are online, are some examples of the way that video chat can be used to support older adults in this isolation. But there are other ways outside of video chat that older adults can use telemental health to support their wellness during the pandemic. You know, not all of these services fall within the scope and practice of licensed, qualified professional mental health professionals, but there are some ways that technology can be used to support mental and emotional health. As helping professionals, we can provide a focal point or an endpoint so that these services are administered in a therapeutically way, a therapeutic manner. I mean, there are text messages. Well, maybe not the best way to deliver psychotherapy and counseling services because intent and emotions we aren't able to always easily communicate intent and emotions through text, obviously. Text messages can be used to deliver factual information, such as appointments, reminders surrounding those appointment times, and confirmation of receipt of information. There's also the telephone. While communications using the telephone doesn't give us that visual observation of our clients, it can be much more informative, excuse me, than a text message. Like using the telephone allows us to hear their voices, their affect, the speed. Sometimes it's just, and that's just something that we wouldn't get using a text message. Also, there's not to mention the various helplines that are available to older adults in crisis. There's a national suicide prevention line. If you guys are interested, I'll put my email in the chat, and I can send you the link of some of the resources that are used in my area and also nationwide. Not to be forgotten are those self-directed services. You know, some of these self-directed services are professionally facilitated self-help groups or help groups. They're self-help groups, mutual help groups, and they can be used in the same way that a client or an older adult would do in person, with the exception that obviously the services are delivered electronically. You know, for those of our clients with substance abuse issues, there are 12-step meetings, AA, OA, and A, and they're delivered pretty much in the same fashion. I mean, while the spirit of the meeting is there, unfortunately, there isn't just that fellowship and that camaraderie. There also,
really
I'm sorry, Dr. Day.
Yes, I'm going to jump in really quick with that topic. These AA meetings, I noticed how resilient that community was when the pandemic first started, of jumping right into telephone groups. Like they would use those different, I don't even know, you'd call them applications or companies where you can have a free conference call, and that's what they were using. And then they switched to Zoom as they were figuring that out. But it was a learning curve, and it also was a little disheartening for some of the clients of not having that in-person interaction because of how sudden it was in the beginning. But now in our presentation today, we'll talk about, okay, how to get people comfortable, and where we are now in April 2021, things have, you know, come a little bit a long way, but we also have Kim's expertise in technology of what else we can use with the clients. But also, I wanted to mention, we have a lot in the chat right now.
Right.
It might be helpful as you continue on.
Mm-hmm.
So a few people had some training before COVID. We have one who actually has the certification for the Telemental Health.
Mm-hmm.
Some have done specifically telephone counseling. Some are using telehealth at the 60%, you know, capacity. Mm-hmm. It's starting to decrease a little bit. And as I read that, I'm thinking, once this country at least reaches herd immunity, I'm believing that we will not go 100%. Mm-hmm. Being in person, I believe that for many, this has opened a door. Maybe they wouldn't have received services before, and now they realize, oh, I can do this online. This is easier. Maybe their mobility is at a level where leaving the house for a 50-minute session just wasn't worth it to them. And I'm even seeing in the chat that some of the counselors are noticing that their older adult clientele has increased, which is really interesting. I think that shows how mm-hmm. accessibility there's more accessibility now. But Kim, I'll let you continue.
Yeah. I mean, I just wanted to touch on mental health apps. It's an excellent way for older adults to stay connected outside of sessions, to continue the work that they're doing in therapy. But I think it should be noted that these types of apps are questionable. There's just doing the research for this project. They're questionable as an alternative or a replacement for traditional treatment provided by a licensed and qualified professional. I think that it's been found, generally understood, that these apps may be helpful as a supplement to traditional treatment. So intersections, right? It's unfortunate. I think that it's unfortunate that we, maybe not so much in this room, but COVID is a thing. You know, let's look at some of the numbers. Like it isn't, there are numbers, there's data to support. I looked on the website, I go to the CDC website tracker, I use that a lot. Let's look at some of the numbers surrounding COVID in older adults as of March 14th. Thinking about COVID in terms of the percentage of cases and the percentage of deaths, there's a negative correlation between the percentage of the cases and deaths, meaning two things. Even though the ages of the infected people of the US population, as those ages increase, the number of let me make sure I'm saying this right. Even the number as the ages of people in the US, as their ages increase, the infected population increase, the number of cases decrease. However, the number of deaths attributed to COVID-19 of individuals in the two groups that I put a little circle on the slide over there, as their ages increase, the number of deaths increase. Like, so from a statistical perspective, there's a strong negative correlation between age and number of cases, but still we have a significant number of members of the older adult community are dying. You know, although there are different factors, I can't say, I wouldn't think to touch on all the different factors. Additional information may be needed to make inference. There's no way to establish causality. It can be considered that just looking at our graphs, that older adults are at a significant risk of dying from COVID-19. The chart clearly displays the higher death rates, and just namely, older adults have been dying more as a result of the COVID-19, even in the presence of lower infection rates. So with older adults clearly at risk for death after being infected with COVID-19, particular precautions are being recommended to decrease the likelihood of their contracting the virus. One of these precautions is increased social isolation. However, one of the side effects of social isolation, not just in older adults, but maybe they have a little bit of elevated risk of suffering from loneliness and disconnected from from their community, from their family, from their friends. I mean, it's changes to their day-to-day activities and their behavior patterns. And these changes affect older adults from a physical perspective, in that there's a reduced level of physical activity. There's the potential for the disruption of their food supply, or there's a reduced quality of their food supply. You know, a body needs adequate nutritional input in order to remain well. And there are links to decreased emotional mental wellness. There are studies that point to, and then there are studies that point to the connection between the physical and the emotional wellness. Emotional mental wellness concerns have been studied directly related to physical wellness. As such, during the COVID-19 pandemic, there have been raised concerns surrounding the levels of various states of emotional distress in older adults. Anxiety, depression, fear and panic, stress, and perhaps suicide ideation and suicide as well. Right? And in 2020, the National Academies of Science, Engineering, and Medicine As cited by the Centers for Disease Control and Prevention, studied and documented the physical and emotional mental wellness challenges facing individuals, which include older adults. The social isolation involved in avoiding COVID-19 has been named in, for example, a 29% increased risk of heart disease, 32% increase in the rate of stroke, 68% increase in the risk of hospitalization, and 57% increase in the rate of emergency department visits. The totality of it is that increased risk of premature death, and or there's a 50% increase in the risk of dementia in older adults. Let's see right here. So there are pros and cons. So we look at the intersection of COVID-19, telehealth, and older adults. There are some pros and cons. I guess one of the pros is, I think someone in the chat spoke on it. There's increased accessibility for people that live in remote areas or that have limited mobility. They now have access to licensed helping professionals. And one of the additional pros involved in telemental health is that you avoid that risk of a waiting room. Anytime there's a gathering or a flow of people through a certain area, there's the risk of contracting the virus. And also traveling, so for example, for older adults who don't have access to their own transportation, there's those connections with other people that put them at risk. And telemental health, one of the other pros is that it's proven to have similar outcomes as compared to people that participate in face-to-face therapy. And there's a high participant satisfaction rate, which keeps folks coming back. They're happy with the services that they're receiving, and they're coming back. But there are also some cons involved with telemental health. Inaccurate observations. We talked earlier about video chat. You do get a chance to see the person face to face, but in the event of the telephone or any other telemental health delivered in any other way, there's the potential increased risk for inaccurate observations. There's also questionable reliability of assessments. In addition, there could be the lack of technical experience on the part of the practitioner, the professional helper, and or the older adult. There's confidentiality risk. We all know that once elements of our life take on or are captured in an electronic format, there are risks there that that we have to be cognizant of, that and to protect the confidentiality of our clients. There's also the potential of tech issues. Knock on wood is always a concern. And then there's training and qualifications. Most of us before, I can't even speak for myself, I'm still a student, but many of the therapists, helping professionals that I know didn't have a lot of experience with telemental health before the pandemic. And it's kind of thrust upon us. I mean, there are certifications out there, but many times acting in the best interest of our client, we just go ahead and attempt to gather those tools. However, we still need to be cognizant that there is training out there and that there are qualifications out there that we can use in order to gather the tools to best deliver, to best serve our client base. And the last con that I had, which I found particularly challenging in my practicum, is getting written consent. Typically, there's a piece of paper, and there's an in-person interaction, there's a piece of paper that clients are asked to sign. Well, how do we do that? How do we negotiate, so it's kind of a catch-22. We want them to be home, and we want them to be isolated in their homes where there is increased safety and away from possible situations where they could become where they could contract COVID-19. However, we kind of sort of need to sign the paper because that's a part of the ethics and a part of our procedures and things, and how we want to make sure that they understand what's, what the sessions, what the treatment is about, and we do need their signature. So it's kind of like a catch-22. I found that personally very challenging. These are just some of the statistics. I thought this was a great slide. It's from AARP. Here are some statistics regarding technology use in older adults. And I think just talking to my colleagues, my classmates, the thought was that older adults don't necessarily use technology in their everyday life. So I wanted to document, I wanted us to see who's using tech, and from the older adult community. The primary tech, and I also wanted us to see what are they using, what devices are they using. The primary tech used by adults in the 60 to 69 age range is a smartphone, which is excellent. There are many services, video chat, talking on the phone, text messages that can be delivered by way of a smartphone. So the 60 to 69 age range, this is the order in which that age range uses the devices, like in magnitude. So for the most part, they use they use cell phones, and then desktops and laptops and tablets and regular phones, e-readers, wearables, and home assistants. Like in that order, those are the devices that are used by older adults in the 60 to 69 age range. The primary tech used by adults in the 70 plus age range is a desktop, which is also encouraging in that many desktops or many monitors come with cameras, and then we could have that video chat interaction with them. So the 70 plus age range, they use desktops, laptops, smartphones, tablets, regular phones, e-readers, wearables, and home assistants. So this is some good news. I think this is good news, and indicators where additional work can be done from the perspective of psychoeducation and connection and interacting with older adults. All right. The older adults already have some of the tools necessary that helping professionals can use to deliver services. Specifically, they're using smartphones, desktops, laptops, and tablets. However, although more younger people are wearing wearables, older adults are not from this perspective. They're not using, they are, but not to the same extent as they're using other devices. In addition, although they may be open to using wearables and home assistants, there have been increases, especially in their usage of these two types of devices. We're going to talk about that a little bit later. But there have been gains in that department, and there can be additional gains. I find that encouraging. The questions may be, so one of the questions that, as helping professionals, the question may be, can we encourage older adults to adopt the usage of wearable technology and home assistants? Just a few things to note, like wearables and other smart devices can often be used in conjunction with smartphones, which there's already a significant use in this population. Smartphones, laptops, desktops, tablets often have embedded cameras that can be used in the delivery of service. We can get that electronic face-to-face interaction. Home assistance. I touched on home assistance, and I'll just take I promise, just a quick sidebar. One of my favorite, don't tell any of my other clients, I do have favorites. One of my favorite clients is a member of is an older adult. I won't give her age, but lady never tells her age. She's in her 90s, and she wanted a way to stay. She wanted to still, she's quite mobile and quite capable of living alone. However, her children were concerned. She is one of our scholars. She is an emeriti. I suggested that she get a home assistant. And she was basically like, well, I don't really know. You know, I guess it's kind of interesting. I was like, I think this would be a good fit for you, because in the event that you're unable to reach another device, meaning a desktop, a telephone, a smartphone, our home assistants are voice activated. So she can say, hey, Google, call my daughter. You know, hey, Google, send a text message to Alexander. And it was pretty much a big revelation for her. I mean, like she and I hope we expand our vision of what can be done with home assistance, especially one of the concerns in the older adult community is falling. Well, and not being able to call for assistance. Well, with an electronic home assistant, she just needs to use her voice, and she's able to access any resource or any family member or emergency help. So, but what are home assistants? They're personal digital assistants that can provide a focal point for older adults and for their technological setup. An older adult can use a home assistant to set reminders and alarms to help them remember things, to send text messages, to make phone calls, to help set up and maintain routines, which is very important, especially during this time of isolation. I myself find that I'm not even always aware, cognizant of the date or the time of day. There's a little bit of disconnection that comes with that, for me personally, comes with being more isolated, connected from the date and the time and the calendar. And I find that routines ground me, and I think that's something that could help older adults. And it could guide us also. Home assistants can guide us through workout routines. Like if we want to address the physical wellness aspect of our clients, it can remind them that it is time to exercise, or it can guide them through an exercise routine. Another problem I think that people are encountering is sleep disruption. While home assistants can provide white noise as relaxation and a sleep aid, home assistants can also help older adults shop for food and other necessities. You can make an electronic to-do list with a little bit more sophisticated setup. You can instigate a purchase using just your home assistants. The pictures that I put up, they're just a few, and the brands or categories that are shown in the slides, they all accept voice commands. And sometimes some of them have touchpads where the touchpads can function. They function similar to iPads, accepting commands and interactions with the touch of the fingertip. Just in the picture, no way a commercial or an avocation, or I'm not advocating one brand or another, but some of the brands listed here are Amazon Alexa, an Echo, a Google Assistant, or a SmartThing Hub. But there are many brands, some not listed here. Sonos One, a Sonos Beam, and an Apple Home Pod Mini. For members of the older adult community that may have diminished cognitive functions or issues with memory, there are features there that help these individuals remain orientated to the world outside of their home, while they're kind of stuck home taking the precautions and isolating themselves during the pandemic. Google Assistant, I use Google. There's a little bit of my bias there, but it can answer questions like, what day is it or what time is it? It could provide reports, traffic reports, weather reports, updated news. Just home assistants are an excellent way for older adults to remain connected and also to reach out to various resources at the same time, including us, I think.
And it's interesting too, when we get to my slides, we're going to talk about how to incorporate technology and using the counseling skills and setting goals. But something I was just thinking about, if maybe your client is a little more resistant to starting with one of those type of devices, in your counseling session, you can actually say, okay, let's hold up our phone and say, I won't say it, but say, hi, Siri, to the phone, and then it'll respond. And you could set, like, maybe a goal is, I will walk every other day. So then you can actually speak to the phone and say, set that timer for every other day at 12 o'clock as my reminder to do this thing. So it's actually really cool how accessible they are now.
I mean, yeah, I didn't consider that's a great thought, Dr. Daniels. I'm considering the thing that I find that is most helpful with home assistants is once they're set up, they're voice activated. And like Dr. Daniels stated, Siri is also an excellent example of a low-level artificial intelligence that can help our clients orientate and organize and to mark and set and achieve goals.
We just got our 6-minute warning.
Oh, wow.
Yeah.
I'm sorry, you guys, I talked a lot.
Maybe we should.
What would you like to skip to? I'd like to talk about your therapeutic approaches.
Yes. So let's go to this beautiful slide here.
Yes.
So, I just wanted to highlight some of the positive components of COVID-19 and how the older adult population is becoming accustomed to this. So in the top right, these are different viral stories in the news. So the top right, we have an improv group. They meet on Zoom and they put their costumes on and they're still able to improv the way they would have in person. And then to the left, we have the lady who has been attending every church service on Zoom, and she dresses her Sunday best every week. She's figured it out and she's ready to go. And then on the bottom right, there's an artist, I forget the name, Isabel Dellinger, I believe, showing how the older adult population is starting to, use technology more and more to stay healthy and also stay socially healthy. So we can go to the next slide. So as we were saying before, these are some of the common concerns with the older adult population. And one of the areas I'm highlighting here is this concept of death and dying. This was already a prominent issue, as this is that stage in life where people may pass due to natural causes or other ailments that the older population is more susceptible to. However, during COVID-19, this concept was amplified. I have a lot of colleagues who were working in different facilities, maybe where this older adult population was living, and some of them did get hit pretty badly in the beginning of COVID-19, where they would go from 20 clients in their facility to only a single-digit number because of either hospitalizations or death from COVID, which is a huge crisis and had led to many of the single-digit number of people who were left behind in major grief and loss and further isolation. So this was a time where there were medical crises as well as mental health crises, really unfortunately. And then presently in April 2021, there's still that stress of staying safe, following the protocol, making decisions about getting the vaccine. Different medical concerns can impact those decisions as well. So then for some people, it's waiting for herd immunity for them to be safe. So there's just a lot still going on to this day. So we can go to the next slide. And as far as using different approaches with this population, the ones listed here on the slide are all those evidence-based type of interventions or theories that we can use with this population. A lot of these center around either strengthening interpersonal relationships or leading to some type of healing from depression symptoms. You can go to the next slide. And specifically with this, as I was thinking about ways to utilize technology, maybe not providing full out counseling, but using the texting as almost a text office hour where your clients know every week, every Friday at 1 o'clock, my counselor will be available to answer maybe a mental health question or send me a resource. So they have that in their mind of, oh, somebody's here for me, willing to just, be that helpful person, and I can check in with them if I'm feeling really depressed from the isolation. When we think about the person-centered approaches, here and now is really important. One, for the counselor to remind themselves about this, because you want to stay in that here and now and listen to what are my clients' needs. This older adult population is extremely diverse. Some are living on their own, some are in assisted living facilities, some are in great health and they're running every morning at 5 a.m. and others might have more physical ailments. So you want to meet them where they're at, and physically, but also mentally, how are they feeling? Maybe they're more introverted and they love this kind of isolation period. And some examples of questions we can ask this population. Can you tell me more about what is most troubling issue on your mind, or what is the experience like for you to share this with me? And when we're displaying empathy, I can only imagine how frustrating that is for you. Oh, we're out of time. And I don't want to.
What else did you want to touch on, Dr. D? I mean, we could just jump to just there are resources out there. If I'll put my email in the chat and I'll send you these slides, or I'll send you a list of these resources. But many internet providers provide free or low cost internet access. There are also some organizations out there that provide free or low cost equipment. If you're in the New Jersey area, if you're local to New Jersey, the Institute for Advanced Study donates some of their gently used equipment to nonprofit organizations. If you're interested and you're local, please let me know. We have a storage room of things that we're kind of sort of trying to get used to, and they're in awesome condition. And just really quickly, and then I'll let Dr. D jump in there. We can help. We can raise awareness. We can use evidence-based approaches. We can advocate, and we can connect this population, older adult, to resources, because there are elevated risks for their physical and their emotional health. Dr. D?
Okay, so we will put our emails in the chat. Unfortunately, we weren't able to give you every resource just now. We didn't realize how much information we had.
Yeah.
We will send it your way. We have a lot of ideas for advocacy, so feel free to reach out to us. And thank you for being here.
Yep. And thank you, Dr. D. I really appreciate you.
Yeah, of course. Great job.
And thank you guys for having us today. All right. And let's see.